Yeah, that's a great question. So people might not realize it, but ECMO runs can be anywhere from a couple weeks to even a couple months in some of our longest running survivors. And even among that group, survival, especially during the COVID pandemic, is probably just over 50% survival out of the hospital. Um, this photo here kind of shows our ideal best case scenario of a patient on ECMO. Here we had a patient who you can see the large tubes kind of coming from his neck that are draining and returning blood, and the really huge coordinated team effort it requires to get this patient up. And he was able to walk and ambulate, participate in physical therapy. Particularly in our patients who are being bridged to a lung transplant, you can imagine their preoperative conditioning and their strength training is just so vital for their chances of recovery and good outcomes following. So this is sort of like best case scenario. But in reality, we have another photo here which kind of shows what we see more often, and that is a patient that usually is more or less bedbound, very heavily sedated. We have found that, while the ECMO therapies can really do wonders to replace the work of the lungs of a patient, they're very precarious. These patients are still very fragile, very critical, and in some really severe cases, even awakening or taking a spontaneous breath, trying to cough, can kind of instigate a life-threatening episode. And so here you see a picture of somebody who is more or less bedbound, connected to the machine. You see, various drips, medications that provide sedation, as well as blood pressure stabilization, this kind of thing. So this is kind of maybe what reality maybe is more like for these patients. And again, as I said, it can be, weeks, months that that people are managed this way.